Good. All right. Well, good evening, everybody. Thank you so very much for joining us tonight. My name is Andrea Miller, and I am president of the National Women's Political Caucus of Virginia. We have a very, very, very simple goal or mission. Our mission is to increase the number of women in elected and appointed positions, to draft legislation and educate people on legislation and issues that threaten the needs of women and equality. And we will be doing that through our Project 2025 series. And we are also working very, very hard to support our endorsed candidates. Right now, we endorse candidates for U.S. Congress, and in 2025, we will be endorsing candidates who are running at the state level. Right now, I am going to introduce Jessica Jala, who will be acting as our moderator this evening. Jess is our Central Region Coordinator, and some of you may know her from her vote equality hat, where she is actually in charge of scheduling the RVG. So Jess, take it away.
Thanks so much, Andrea, and welcome everyone. We're so excited you are here to continue this conversation and deep dive into the specifics of Project 2025. And as Andrea mentioned, we're going to take a really close look at what this impact would have on women and their maternal health care and reproductive freedoms. We have three amazing individuals who are joining us this evening. Our first guest is Dr. Jennifer Lesko, and Dr. Jennifer Lesko joins us this evening, from Richmond, Virginia. She is an MD, NPH, OBGYN, a complex family planning specialist and educator, a physician advocate for reproductive and maternal health, and she failed to mention that she's also a mother who is very active in her community. Over 2 decades, she has worked with the community of New York City, Chicago, Boston, Washington, D.C., and Richmond, Virginia, to increase access to vital services of abortion and contraception. In Washington, D.C., she worked with multidisciplinary teams to improve maternal health care on labor and delivery. Here in Richmond, she is educating the next generation of OBGYN physicians to provide excellent clinical care with respect and consideration for each patient's individual values and beliefs. Thank you so much, Dr. Lesko, for joining us. We know you have an incredibly busy schedule, especially right now, and we can't even imagine what time this is from your family. So thank you so much. We really appreciate it. As an OBGYN and complex family planning specialist, what is the current state of reproductive care here in Virginia?
Well, honestly, in Virginia, we're a little bit lucky. We do have some, I wouldn't say that we have protective laws with respect to access to abortion care, but we do have laws that at least allow us to provide that sort of care until the second trimester. This is really important for patients who, find out usually in their kind of 22-week ultrasounds if something is wrong. But what it has become is we've become essentially a safe haven for a lot of people who are coming from southern states that are near us. We are bordered pretty much on all sides by states that don't provide abortion care, with the exception of Maryland and Washington, D.C. And so because we are kind of the first stop on the way out, we are seeing increasing numbers of patients who need this care. The other thing that's really sort of unique about where we are, I do work in an academic center, and so we tend to get patients who otherwise would not be able to be cared for in community centers, where maybe the access to blood transfusions or additional medications, or even the operating room for sort of surgical procedures to manage any sort of bleeding issues. So we're getting some very complicated and complex patients in our clinic, and it is really it's a lot for these people to travel, to have needs for childcare, for trying to find time with work, and these are things that are daily challenges for these patients. And it's it's hard sometimes for us to do the work, but it's even harder to be a patient when you're going through this. It's and a lot of them don't have health insurance coverage for it. Virginia, unfortunately, due to the Hyde Amendment, and also Medicaid not paying for abortion, it is really even a challenge for many of our Virginia patients to pay. So these are some of the obstacles that we are facing on a daily basis.
Thank you for sharing that with us. And I'm sure, like many, we've heard about all these things, but we didn't realize that it was happening here in our own state in Virginia. So thank you for shining a light on those things that you are seeing pretty frequently. Project 2025 states that it will crack down on abortion tourism. You kind of mentioned that a little bit in your opening remarks, but can you explain what abortion tourism, because that is sort of one of those words that we see often in the news, and what effect it might have on physicians in Virginia to provide care if Project 2025 is rolled out?
I mean, these are really great questions. I mean, I would encourage you to go. There's actually a great graphic, I think, that the New York Times put out looking at before Dobbs fell and then after Dobbs fell, the essentially the number of patients who are traveling out of their state to obtain abortion care. And the numbers have, quintupled in terms of people coming from Texas, Arizona, and then going to various other states where provision of care is more available. But the thing that's actually the most concerning in these situations, and this is kind of where Virginia is a little bit lacking in protective measures, we don't have any laws that protect physicians from providing abortions to patients out of state. So if, there are laws that are passed in states that will criminalize the provision of abortion and potentially try to do that to the physicians who are providing out of state, we don't have any laws that technically protect us. And so that is a challenge. And I think that is something that is quite scary. And we know that physicians and nurse practitioners and other midwives and other, care providers who are trying to provide these sorts of services in other states are often stymied by fear of being, jailed or incarcerated or sued or something along those lines. And I think that would just only decrease access because, I think people would sort of act in their, in their own best interest in those situations sometimes.
Yeah, thank you for, again, bringing that to our attention. I think we, again, hear about that happening in Texas, and we don't think that it's actually happening here in Virginia, that fear that physicians can't provide the care that they really desperately want to provide to their patients. And I even have to say that I have a couple of friends who were in need of abortion services, and because of these long wait lists and some of the fear that is around it, they actually had to wait an incredibly long time just to find the care that they needed. For their family. So it is happening here.
Yeah, we're taking 2-3 week waits to take care of some patients, which is, you can imagine you're finding something out that's absolutely, for any reason, right? Like anybody can have this for any reason, but, we do have patients who have highly desired pregnancies and they find out something absolutely catastrophic has happened. And, they're sitting there feeling fetal movement, while they're waiting to do this. And it's, I think anybody can empathize with that being a pretty unpleasant and really challenging thing to endure.
Yeah, for sure. Challenging is the least of it. I think there's so many challenges. We're, again, so glad that you can help us understand this and to provide the care that's necessary for Virginians to make these really important decisions that are their own decisions. We also know that there was a recent SCOTUS decision keeping in place a federal law requiring that hospitals provide emergency care to pregnant people. But Project 2025 wants to stop enforcing that for us in here in this Virginia space. What SCOTUS ruled on and what it would mean to your practice if Project 2025 stopped enforcing that law that SCOTUS said had to stay in place.
Yeah, I think that this this goes, it goes back to the fact that essentially abortion care and the care of anybody who is presenting to an emergency room with bleeding and pregnancy are essentially one and the same when it comes to the actual clinical decision making and the provision of services. There may be nuances and differences in terms of kind of how that patient is feeling about where they are in that moment in time. However, we're risking criminalizing women for having miscarriages with repealing of this. We're risking women not receiving the care that they need. I think Kamala Harris actually said it very well in the debate, like a woman presenting to an emergency room and being turned away, bleeding, and forced to bleed out in her car because the emergency room was fearful of taking care of her and being, incriminated for providing what could be construed as potentially abortion care. And so, there are scary things that are happening with ectopic pregnancies. They're scary, which are, having a miscarriage is certainly risky and can certainly lead to life-threatening bleeding, but for the most part, thankfully, that doesn't result in that often. But we do see women with ectopic pregnancies where this is life-threatening, and we're seeing emergency rooms hesitate on whether or not to treat these people, and this just would only allow that to happen more. And we know that restricting abortion access only restricts access to maternal health in general. I mean, there are life-saving drugs. Misoprostol is one of them. This is a life-saving drug in postpartum hemorrhage on labor and delivery. And Louisiana just made it a controlled substance. That's terrifying. That means that a shelf-stable, something that does not need to be refrigerated, that can be grabbed in an instant, that can be stored in nurses' pockets, and can treat postpartum hemorrhage, is not available because it has been used for medication abortion and someone's labeling it as a controlled substance. So this has far-reaching consequences, and it's really quite scary.
Can I circle back to the controlled substance? Because that was not, I know, one of the questions that we gave you, but it came up when we say controlled substance.
So it means
are we seeing people push against? Go ahead.
Oh, I mean, I thought you were asking me the definition of it. I'm sorry. So a controlled substance would be basically like similar to an opioid. So there is tracking that is done with controlled substances. So it also takes away privacy issues. So we're talking about people who may get misoprostol to manage a miscarriage, but because it's been prescribed, now somebody knows that that was given to them. And if someone makes an accusation, it is potentially someone's word against another. And that's not, obviously that would be, have, again, far-reaching consequences for someone who, is mistakenly thought to be doing an abortion instead of having a miscarriage.
Thank you for clarifying that. You took all of my questions and figured it out real fast. So thank you so much. Are you seeing any of these hypothetical situations right now that we understand in Virginia, like Louisiana, being chattered about in your practices or in the rooms that you're working? Or is it something that, again, hasn't hit Virginia yet, and we're just talking about it because we're talking about Project 2025? Or has there been this fear that's sort of brewing that these sorts of laws will come into Virginia?
I mean, I think we always fear that. I mean, Virginia has had a bit of a roller coaster with respect to, kind of the laws that are in existence in terms of access to abortion care. One of them has been the transvaginal ultrasound law. Like, every woman had to endure a transvaginal ultrasound before getting an abortion. And now that is no longer something that's required. There used to be a 24-hour waiting period, meaning that if someone came in, they needed to come and talk about it. And then they had to come back the following day to then sign consent and proceed. And so it's obviously a huge barrier. Again, when we think about what most women who have abortions, who they are, most of them are mothers, right? Most of them are women who know what it's like to have a child, and the tremendous responsibilities that come along with that, and recognize also maybe that with the money they make and the number of children they already have and the family that support that they either have or don't have, that this is not the right time for them. And so, I think that having those sorts of barriers are really ones that are huge obstacles for people who may not have resources. And we're also talking about women who, I would not say this with absolute certainty, but a lot of our patients who need abortions are on Medicaid, and Medicaid doesn't pay for it. And abortions aren't cheap. They're not inexpensive. We see funds sort of throughout the country and funds throughout the state that are providing these kinds of, of supplemental, sort of money to help people get places, to feed them while they're there, to help them stay here. So to answer your question, these things are not always happening as, I think, acutely in Virginia, but we do see some of that, with respect to a lack of access that, I think we have the fear of, is that going to get worse, with people who are maybe not enlightened about this, or who don't feel like these are important values to stand by.
Thank you so much. I think it's always important to kind of bring it back to Virginia and to say, this does include us. We need to have these conversations with our friends and family, that even though it's not really visible, it's still happening here, and we need to be cognizant, and we always need to be vigilant about it. So again, thank you so much for your time and your expertise.
Can I say one more small thing?
Go for it. Yeah.
I want to put a plug in for two things. One is that, I will say that, with the Equal Rights Amendment, all the work that has been done to make that pass in Virginia, I think some of the stuff that needs to come out of that in the future in Virginia is, and hopefully sort of nationally, is that every single woman has, the reproductive sort of mission framework is that every woman has the right to parent or not parent, and to raise their families in safe communities. And when we have those things present, then women are primed for success. And I think that one of the things that really makes me really sad in Virginia is the number of patients that I've seen who have lost an opportunity to have children when they want them. And IVF is not covered by Medicaid in Virginia. It's not mandated to be covered by Medicaid in Virginia. It is something that I think we also need to work on, because as much as I believe that a woman has every right to not carry a pregnancy, I also believe that for women who want to be mothers, this is something that we need to do a better job of helping them with.
And if I could just ask you one question, a question just came up in the chat that I think you could probably answer better than all of us. Should we be concerned about the Comstock Act, which is still in the books as federal law?
Yes, I think we should. I think for a long time it had been sort of thought of as something antiquated, and unfortunately, as we know, even with gay rights and sort of like trans rights, we're seeing some of those what seemingly seem to be antiquated laws that didn't seem to be anything are now getting sort of held up as a beacon. And I do fear that with the Comstock Act. I mean, essentially what it was is a provision of laws that passed federally in the 1870s, 1873 exactly. And what happened was that it prohibits the federal USPS, essentially the mail service, to transport any materials related to essentially anything that would be considered unsavory materials, but also things like abortion drugs or contraceptives. And so, this would essentially preclude male abortion, which is something that is occurring. And that's how a lot of women are getting abortion care in the southern states. It would make abortion completely illegal in all 50 states if we actually did not repeal this and actually used it as a law. Medication abortion is the most frequent way that people are doing abortions now, for a variety of different reasons. And I think it is something that has significant potential to really harm women if it's put into place.
Thank you again for all your expertise and sharing it with us. And thank you for your comments about the Equal Rights Amendment. And we know as Virginians, that's something we fought hard for. And we really appreciate that you are bringing those two together and showing that we really need to value each person as individuals and equally. So again, thank you so much for your time and your energy and your work that you do here for all Virginians, especially in Richmond.
Thank you. Thank you so much for having me. It's been a pleasure.
Our next guest is Senator Ghazala Hashmi. I will want to welcome you to the stage. And I wanted to take a quick introduction. We all know you and see you all the time, but just for those of us who may not see you as much as some of us, just a brief little introduction. Senator Hashmi is an Indian-born American politician and former academic administrator and educator. A Democrat Senator Hashmi represents the 15th district in the state of Virginia. She worked as an educator and academic administrator for 25 years before running for office. Thank you so much for being here. We appreciate all the time you've come to these events with National Women's Political Caucus of Virginia and the work here you do as a senator. Welcome.
Thank you.
And one of the questions that was dropped into the chat, I got too excited. I apologize, because I think you are going to also touch a little bit about how the Comstock Act is here in Virginia and how we should view it as Virginians in that lens. But before we get to that, I just wanted to acknowledge that I jumped a little ahead in my planning. But can you describe the current law in Virginia regarding accessing reproductive care?
Well, good evening to everyone, and thanks to everyone who has joined us. And I really appreciated the comments of our earlier panelist, Dr. Lesko. Thank you for the perspectives that you've provided as a medical provider of abortion access and care. And it's a very necessary perspective, because we need to hear some of the issues and concerns that our medical community is facing. And as legislators, we need to continue to think about how to improve the opportunities that we have in Virginia to strengthen our laws. But I will just start by saying, it is sad, but it is also a testament to what we've been able to accomplish in Virginia, that we are the last Southern state to provide safe and legal access to abortion care. And we are seeing so many individuals traveling across state lines, coming to Virginia, seeking that care, or reaching out for prescriptive care that provides them medical abortions as well. And Virginia still stands out then as a result of the work that we've done in 2020 and onwards. In 2020, we were able to gain a trifecta in Virginia. And in essence, those are the laws that continue to protect individuals who need abortion care in this state. And when we achieved the trifecta, not only did we put in protections for abortion access, but we also repealed some rather horrific legislation that had been passed previously. And you heard Dr. Lesko mention the transvaginal ultrasound. We also repealed the TRAP laws that really put such a burden on our medical community and really sought to restrict access to abortion care. So what is protecting Virginia right now is the Virginia Reproductive Health Protection Act that was passed in 2020 that defined better or clarified better the provisions for abortion access, that took away those TRAP laws, the 24-hour waiting period, and so forth. We also were able to, in that same act, expand the providers who could serve the needs of patients. And those included nurse practitioners, so that they could provide abortion care within that first trimester, which we know overwhelmingly the large number of abortions take place in that first trimester. So that was a very critical item as well. We also pushed to include abortion access in our state healthcare plans. And so the state health benefits plan include coverage for abortion care. And we took away the ban that was previously in place. Now, one thing to think about is the way in which our current governor and the administration has continued to try to reimpose many of those items of legislation. Every year of this administration, I believe we have seen efforts to take away access for our low-income communities, individuals on Medicaid who are suffering a pregnancy that has gross fetal anomalies. We know that the baby cannot survive. And what the governor would like to do is impose on these individuals the need to carry the pregnancy to full term, knowing that the baby will not survive, not survive this catastrophic anomalies that are in the development period. So there are several efforts then that we have made to counteract the measures of this administration and some of our Republican colleagues. If we didn't have a Democratic majority, what we would be seeing in Virginia is similar to what's seen across southern states, which is a total or a near total ban on abortion, and certainly removal of access to abortion care in so many different communities. Now, Dr. Lesko also spoke about the concern that medical providers have with the criminalization of abortion care and the fear and the anxiety that's in the medical community that they could be extradited or that they could face legal consequences from other states as they pursue their patients across state lines and then seek to prosecute the medical community. So we have seen introduction of bills that would be shield legislation to protect our medical providers. Those have not been successful these past two sessions, sadly. I am planning to introduce a comprehensive shield bill as well this upcoming session, and we will be fighting to ensure that there are protections for our medical community. We've also been fighting for the right to contraception and equity in contraception. And again, those are really critical items of legislation as we see targeted efforts to take away the right to contraception. Clarence Thomas has already stated in his opinion on the Dobbs decision that he's ready to dismantle Griswold, that 1965 decision by the Supreme Court to the right to privacy, which would allow individuals to have contraception access. Only married people at that time, 1965, but certainly the fight for contraceptive access is very much a part of this discussion as we go forward into this election.
And if you don't mind, I'd love to ask you how we as NWPC and fellow advocates and constituents can help you with these comprehensive shield bills and the equity and contraception bills that you mentioned. I wanted to tie it in with the success that you said we found with the nurse practitioners, because I think you touched on that we did this in this last General Assembly. How was that done, and how can we use some of those strategies to make sure that these shield bills and equity in contraception are part of a bigger conversation in the General Assembly, especially with you leading the charge?
Yeah, great question. You know, the successful legislation that we passed those in 2020 and 2021, and that's when we had a Democratic trifecta in place with majorities in the House, the Senate, as well as the governor's office. And what challenges we've had now with so many of our legislation, such as subsequent shield bills that were introduced post-Dobbs, is that we had lost the House for 2 years in 21 and 22. We've regained the House now with this past session, but of course, I'm sorry, it was 22 and 23 that we had lost the House. And then in the 24 session, we regained majorities in both chambers, but we face a governor who has vetoed the bills that we have passed and sent to his desk. And so the real effort has to be around our elections right now, ensuring that not only do we have a successful election this year, but as you know, Virginia operates on the off cycle. And so it's going to be next year that's going to be absolutely critical for Virginians. In the 25 election, all of our 100 House delegate seats are up for re-election, as well as the governor's, lieutenant governor, and AG election. So that's got to be our critical focus. Tied into that is the amendment, the constitutional amendment to protect abortion rights in Virginia. We are going to pass it this year. I'm confident of that. We have the majority in the House and the Senate. We will see success in passing the constitutional amendment. But what we have to do is re-elect a majority next year because a second General Assembly is required by the Constitution to pass it again, that same legislation. So it has to pass the General Assembly twice, with an intervening election, which will be the 2025 election. And then it will go to all of the voters in Virginia on the November ballot in 2026. And so that's going to be our critical step in order to protect access to abortion through the constitutional amendment.
Thank you so much for clarifying that and reigniting our interest in making sure that we do elect those officials that we know that will stand behind the mission and the values that we have here in NWPCVA, and to really, emphasize that elections matter in Virginia every single year. And someone also dropped in the chat, it's important to have the lieutenant governor and the governor, but with this constitutional amendment, we need folks to realize that it's the legislators who are really ensuring the passage. So that is even more critical, that we use our voices and we use our networks here to get out the vote for those who we believe that will stand for all Virginians. So thank you so much for clarifying that for all of us here. I did want to ask you another question. You again mentioned this a little bit, and Dr. Lesko mentioned this tracking issue that we've heard about in the news. Project 2025 mentions tracking pregnancies and miscarriages state to state. What would that mean for the privacy of Virginians?
Yeah, privacy is going to be a very big challenge. It already is, frankly. We have so much increased technology and surveillance products that are already tracking our every movement. And a lot of times it is our business and industry partners who are tracking what we're buying, what we're consuming, where we move, where we shop, where we live. All of that data is being collected and stored, and privacy is hitting us all on in important ways. But around this issue on the healthcare privacy concerns that women are rightfully concerned about, we have to be as vigilant as we can, and we have to think about the devices and the technologies that we all are using on our bodies and on our phones. And so when we saw the frightening concern that just a simple tracking of your menstrual cycle on an app, that some states have already moved to ensure that can be, that's information that can be used and criminalized against women. We knew in Virginia we had to take action. And so we saw last year in 2023, Senator Barbara Favola had introduced a bill to prevent law enforcement to gain access to menstrual health data. We also saw the governor administration send a spokesperson to come and speak against that legislation, and it failed to pass a Republican majority House as a result. It became all the news. I think some of us remember that even Stephen Colbert and other folks were targeting and talking about the fact that the governor of Virginia wanted access to menstrual data, Virginia women's menstrual data. This year, we were able to successfully pass legislation that protects menstrual data, but that is just a slim sliver here, because what we know that other states are doing is tracking individuals who are pregnant, who may be going across state lines. And I just want to say, I don't call that tourism in any context, medical tourism. I really see these individuals as medical refugees. We have created a crisis in this country where we have individuals having to cross state lines in order to seek the medical care they deserve. And so tracking and a violation of privacy is absolutely happening in many states. And it's something that here in Virginia, we are looking at closely, because we want to ensure that we protect the data and the privacy of individuals, but that we also shield any efforts to harm our medical providers who provide access to individuals that are coming from other states.
I just wanted to highlight Roxanne, who mentioned in the chat medical refugees. And I think that's to your point, Senator Hashmi, is that these are real individuals who have needs, and we need to help them and to have a mission of caring for others and caring equally for them, because they are humans going through a very human process. I wanted to touch really quickly back on when you mentioned that Virginia did pass this past year a sliver of what we wanted to pass. Can you remind us what was passed to prevent tracking of that medical history and menstrual records?
It was the menstrual data protection that we were able to get across the threshold this particular session. And it, again, the governor stayed quiet this time around, and we were able to get that bill passed. So if you are using an app to track menstrual health, and inputting that data, that is not accessible by law enforcement here in Virginia.
Thank you for clarifying that. And I just wanted to bring that up because I think it was a united effort from the senators and the House of Delegates and advocates really getting the word out. It was a good show of force from everyone, and a big interest that obviously made national news. So thank you to those who were on this call who made that happen. We know that it's really hard work to keep up the pressure, and we're so proud to say that we did it alongside one another. So thank you for leading that and supporting that, and any of those advocates who are here on this call, because I know there are a few. I have one last question. I believe we did speak about the Comstock Act with Dr. Lesko. Do you see anything like that happening here in Virginia if Project 2025 were to be passed?
Well, the real concern is that we lose the White House, because what's been when the Dobbs decision came down, many states then reverted to upholding the Comstock Act, which prevents the dissemination. As Dr. Lesko was saying, in essence, it is that no federal agency can disseminate information, and it also included at a later point medication that would provide abortion care. And so what we are seeing, it started as anti-obscenity. The Comstock Act was really an anti-obscenity act, with the argument that even talking about reproductive health care was violation of obscenity laws. And so even doctors could not share information about contraception, about reproductive health through mail or other means to reach their patients. And so once the Dobbs decision happened, then many states grabbed the Comstock Act and have said that dissemination of information, even if it's contraception care, and that's why I've been pushing on the Right to Contraception Act, because the Comstock Act makes it a violation even to disseminate contraception. So we're talking about IUDs and morning after pills and so forth. So the only thing that's protecting us right now is that the Biden administration really restricted the impact of Comstock on a nationwide application. And so should we lose the White House, should we see a second Trump administration, we've already seen them very clearly spell out, it's in Project 2025, that Comstock will be upheld, and that not only is it going to impact abortion, but the way Comstock was written and revised over the centuries, it affects contraception. I'm sorry, it doesn't affect just abortion, but it affects contraception as well. And so that is going to be a really serious concern, because that is a federal directive then, and it would have impact on what we are able to do in Virginia. And again, this is why this election is absolutely critical, that we prevent a second Trump administration.
Thank you. And thank you for restating that Project 2025 clearly states that it will reenact the Comstock Act. And so that really has huge impacts here on Virginia. And thank you for detailing out what that really means to Virginians if it was enacted. Again, thank you so much for your time, Senator Hashmi. We know you are doing lots and lots of different things and are supporting a lot of the candidates here in Virginia who are women candidates running for those offices. You are such a leader in the Senate, and we know that all the work that you do in the General Assembly has led to some of these larger bills that protect menstrual data and better state health benefits and prevent trap laws. And we can't thank you enough for all the work that you've helped Virginians to achieve year after year. Did you have any closing remarks that you wanted to provide to us before we say goodbye?
I just really appreciate all of the work of this community in particular. You're right there beside us and championing the legislation and helping to educate Virginians on how important it is. So thank you so much.
Thank you for joining us. And yes, there's lots of chatter that yes, Senator Hashmi, we appreciate you and everything you do to protect us.
I don't know if is it me or is Jess frozen?
Jess is frozen
She's
and her camera dropped off. So what I'm going to do, okay, yeah, she is working on getting back to us. Because we have one more guest who will be joining us tonight. There she is.
I am so sorry. Who knows? I live in the middle of a city. You would think that I would have excellent Wi-Fi connection, but here we are. Thank you all for your patience. I apologize again. Thank you, Senator Hashmi. I'm sorry that that was a quick exit. Again, we love to support you and work alongside you and championing you. We do have one more guest, as Andrea was telling you all. We have Gloria Witt, who we're going to bring on. Welcome, Gloria Witt. How are you?
Well, thank you. Thank you for the invitation to join in on this critical conversation. I am doing wonderful. Thank you so much.
Well, we wanted to bring you on as you know, but many of our guests may not know. Gloria Witt is an endorsed candidate from CD5 from NWPC, and our endorsement team had an incredible conversation with Gloria, and we are excited to stand behind you and to support you in all the ways that we do. As you may know, Gloria is in a very rural district, so our help and support is dearly needed, whether it's phone banking or texting or postcarding. We're here for you, Gloria, and I'm sure you're going to drop some of the other ways that we can help you out as WPC members in CD5. So if you want to make sure, we'll probably drop some of those information as we chat here. I also lost my question, so bear with me as I pull those back up.
I've got you, Jess.
Thank you. Okay, I got it.
All right.
So a brief introduction of Gloria Witt. After a career with global energy lead Framatome, Gloria retired in 2013 and became founder and CEO of Define Success Coaching. Throughout her retirement, she dedicated herself to giving back and helping others succeed, serving in leadership roles in 7 civic organizations, including president of NAACP Amherst branch and the Central Virginia Academy for Nonprofit Excellence. Gloria Witt's decision to enter politics was driven by the assault on women, minorities, the LGBTQ+ community, education, voting rights, and other critical protections. Again, thank you, Gloria, for joining us. We are so appreciative of you. So can you tell us, as a candidate in CD5, some of the discussions you have had with voters in your district about accessing maternal and reproductive health care?
Yes, that conversation has come up in District 5 because on the southern end of the district, There is one area that they have to travel a couple of hours to get OBGYN services because of the, I would say, the cost benefit analysis in the healthcare district, finding medical help and being able to service that area. So there are challenges, believe it or not, in the southern end of the district where women don't have access. And it's also a challenge in those very areas as healthcare facilities move towards more telemedicine. It's a double whammy because sometimes you can get care now through telemedicine. And when the internet is not strong on that end of the district, it makes it even more challenging because they don't have access to a physician that may be remote, particularly in terms of just the conversation and the coaches prior to the actual physical visit. So there are challenges and there's still work to be done, whether it's limitation of available physicians and even just nurses in some of the areas in District 9.
Sorry about that. I even heard a conversation about a woman who was going into labor, and because she was in one of these areas that you mentioned, she was FaceTiming with her OB that was an hour and a half away, and she was in labor as her husband was driving her to those emergency services. So these are real things that are happening, and it's happening in Virginia. So thank you for having those conversations with your constituents to bring it to light that we need to have someone like you who can champion the protections that we need.
That is so true.
We heard the presidential debate earlier this week. The candidates discussed access to IVF and contraception. We know Project 2025 calls for including personhood language into policies. What do you want voters in Virginia to know about your position on this?
Well, for me, I have a simple answer. Roe versus Wade settled the personhood question. And I believe through the advancement of Christian nationalism that has inserted itself in our political arena, particularly when it comes to this idea of religious freedom and choice, somehow our abortion conversation and our full women's reproductive health has gotten hijacked. And so for me, the idea of codifying Roe versus Wade settled the personhood question. And it's just now become a new conversation for me, stemming from the Stack Supreme Court. We solved that issue when Roe versus Wade was passed. And now we're here again arguing about when does personhood start, at conception or some later date. So for me, we just have to codify Roe versus Wade. That particular law was working for women across this nation. And somehow it's been hijacked. And to me, it's it's the forefront of the Christian nationalism movement to use our faith to roll back and control our freedoms. And it's clear in the Constitution, separation of church and state. And at some point, I will be bold enough to say that the MAGA movement is really about rolling back our freedom of choices. It is not just our abortion and our women's health care that they're targeting. And that is why we have to stop the implementation of Project 2025 across the board. Because if they can do that to women after established law has been passed, what's next? So it's a tipping point to a larger rollback of rights and freedoms, is how I see it.
Thank you for making those conversations real that you're having in your district and how they tie into our larger state, because we really do need to pay attention to what Project 2025 is saying and what the ramifications would be if it were to be implemented. not just at the federal level, but as it concerns Virginians, because this is where we live, and you're hearing those conversations about how it will have real impacts in CD5 and across our whole state. Is there something else you want to tell everyone on this call? We have a couple of minutes left for you to let us know how else we can help you. Roxanne and Andrea have provided some information here in the chat about phone banks and how people can sign up to write postcards. But is there anything else that we can do to help support you as an endorsed candidate for NWPC?
Well, I believe that postcarding is a strategic tool that is going to make a difference in this race because it's targeted and you can reach people in ways that you can't reach through phone banking or canvassing because it's going right to the door. So thank you, Common Ground, and all the other postcards who are engaged in that volunteer work. It is going to make a difference. The other thing is we're living in an America when talking about democracy and our rights and freedoms from a democratic platform, it's chilled. Too many people are afraid or hesitant to talk about the importance of this election. And this particular election is not just about Democrats and Republicans or independents. So my challenge to everyone on this call is to start talking about it. I use the analogy of the butterfly effect. Many of you have heard it, but it's this idea of what happened when Kamala Harris was ascended into the president's role. Thank you, Joe Biden, for putting country first. But what that did was demonstrate the power of a butterfly effect, where one Zoom call could connect literally 100,000 people. And this is what it's going to take in this moment for us to stop Project 2025. We all are going to have to start talking about the what's inside of Project 2025. And when we have people eating at our table and our family and friends that say that they are MAGA, I'm with Trump all the way, and I'm MAGA, make America great again. What does that mean? And here's the question: what attracts you to the MAGA platform? That is a powerful question because most people that I run in canvassing cannot answer what the attraction is or what it's done for them. So then we need to switch that conversation and talk about what you care about, because what we care about as human beings is on the Democratic ticket. People first, taking care of, protecting democracy, advancing justice, restoring our hope through opportunity and economic growth. That's what this country is about. It's not about rolling us back and taking away freedoms. It's really that simple. If we lose this race, we lose democracy. So that's the kind of conversation. It sounds like hyperbole, but it's real.
Well, if you want to join that
America.
butterfly effect, let's do it, right? So,
Exactly.
so if you want to join Gloria's butterfly, spread your wings. There's a couple websites. There you go. I love it. There it is. Spread your wings, join Gloria. She's ready. She's rolling. There's a lot of ways. We love to postcard. We have postcards for Virginia on here. We have Center for Common Ground. We have some amazing postcarders. So I think many of them will jump on your request and your call to action. It is in the chat. Gloria's witforcongress.com /donate is also in the chat. So please make sure you pay attention to that information. I do have one quick reminder. Gloria, thank you so much for joining us. Make sure you get out there and support Gloria in all the ways that we can. Again, she is our endorsed candidate for NWPC.
Thank you.
Jess, your internet is as bad as mine tonight.
Whew. Am I back? Holy moly.
You're back. You're back.
All right, I'm going to do this quick because it's wiggling on me. NWPC Virginia is working towards the constitutional amendment that you heard from Senator Hashmi. We are requesting everyone on this call to fill out the Google document that Roxanne dropped in the chat. It's called Refresh Row. We want to hear from you. How can we refresh Row going forward in Virginia? This will lead the conversations. And we need to hear about you. Senator Hashmi wants to hear from you. All those who are working towards this constitutional, remember, it's not up to the governor, it's up to us and our legislators. So please drop that information. It takes about 2 minutes. I promise it's not super long. And we really need that information from you all. Thank you so much for joining us. I apologize for my unstable internet connection. We will work on it going forward. Have an amazing evening. Thank you all for joining us. And we will see you next week at 7 o'clock to talk about voter suppression and Project 2025.
With Jennifer McClellan. Woo!
Woo!
McClellan.
All
Thank you.
right. Yeah. I'm going to drop a link in the chat for our Project 2025 voting or 2025 it's voter suppression on steroids. Now, in Virginia, thanks to our incredibly wonderful delegate, or actually no longer representative, Jennifer McClellan, Virginia is in a very, very good place. We will have 2 guests on Sunday, Dr. Monica Brown from Georgia and Jocelyn Nolly from North Carolina, who will be able to talk about 2 states that did not have a blue trifecta. As a matter of fact, North Carolina, the conservatives have a supermajority in their legislature. So we're going to hear what Project 2025 and or the precursor to it, what it has done. I'm also going to talk about what's going on in Arizona, where in order to register to vote, you now have to prove that you are a citizen of the United States. So it will be very, very important. Now, we support the candidates that we endorsed. I've dropped a link in the chat that will allow you to sign up to phone bank for our candidates. We are going to be building out more phone banks tomorrow. So go to our Mobilize account tomorrow and there will be more phone banks there. If you have more phone bank trainings, if you have already phone bank for either NWPCVA or Center for Common Ground, I also dropped a link at our website, nwpc-va.org, make phone calls where you can go, you can access the phone banks. They are open 7 days a week from 9 a.m. to 8 p.m. daily. So thank you all for joining. Roxanne, did I forget anything? Is there anything that we need to add? And Catherine White, I know you're here. Anything that we need to add?
Yeah, you left out one little minor detail for next Sunday, and that's your good friend, Congresswoman Jennifer McClellan is joining us next Sunday. She was a late confirmation, so did not want to miss sharing that with everyone.
Oh, yes. She is our hero,
Yes.
literally protecting Virginia from all the voter suppression that we are seeing in other states without her forward-thinking Virginia Voters' Bill of Rights.
Yes. I'm excited to have her on, and I saw that she was on the Repro bus that went down and is traveling through. So I think the Harris campaign has put her in charge of the reproduction, where that bus that's going around. So she'll have a lot to talk about. So I think she could probably jump a little bit on reproductive rights and next week, and that's going to be really cool. So thank you, Roxanne, for putting this together. And she's super great. And adding in, I'm just guessing that I'm thinking like this group, get our members to try to find it maybe a day where we just say, let's do a party together and get on the phones for the gals. And I think that gets people to show up. If we say, we're all going, and we just pick a day, Andrea, and say,
Yes,
do it.
yes,
I think
yes,
we can get
yes.
a couple hundred people in the room across the country even and go for it, you know?
Our Zoom
And
room holds 1,500 people, so we could do it.
I think why not? I think why not? And I feel like we can do it. So that's my challenge to us tonight is I know me, if I have a buddy, I'll do it. If I know Jess is coming, I'll show up. So, all right. Thanks.
And it's going to be really important here in Virginia. If you listen to all the buzz about all the must-win states and, you know, these are battlegrounds and this is
Right.
this, Virginia, we are not on that list. So we are going to need to do it for ourselves, like we have done so many years before.
Yeah.
And this time we have got an opportunity to send so many reproductive and voting and just good, solid values and rights to Congress. We really have to do that.
Yeah. And I
So
agree.
love to see you on the
Let's
phone.
do it. Yeah, I agree. And I think for this group, we're smart. We're looking to 25, like Senator Hashmi has reminded us. And I think about it all the time when I'm out on the doors. We know that we are all the way to 25 to really do what we need to do. So thank you for your leadership, Andrea, and good stuff, Roxanne and Jess. Thank you.
Yes, what an incredible team we have here at National Women's Political Caucus of Virginia. And with that, I am going to thank you all for joining us once more. And yes, everyone who signed up, they all know the drill. If you sign up, you get the links and you get the recording. So again, thank you all very, very much and good night.
Thank